Hello and welcome to the Doc Podcast. I'm your host, Dr. Mike DeLuke, and it's my mission to help you lead a happier, healthier, and more prosperous life, both personally and professionally. Hello and welcome to this episode of the Doc Podcast. As you may know by now, and as it says in my show intro, my goal is to bring you diverse content that can help you succeed both personally and professionally. I try to cover a range of topics from clinical to financial to health and wellness. And today we're going to be talking about the latter. We often hear about achieving balance, so much so that it's become a bit cliche. And while we all likely know what achieving balance means, many of us don't know how to actually achieve it in our own lives. We're busy. And life can be difficult, sometimes very difficult. We have so much coming at us and so many responsibilities in our personal and professional lives that oftentimes it can feel overwhelming. In some cases, it reaches the level of depression, substance abuse, and tragically, even suicide. It's not enjoyable to talk about, but the reality is that many of our friends and colleagues are struggling, really struggling. And I believe one reason why is that we're never taught how to cope with all the different things we have coming at us. We just keep working and achieving and adding more and more to our plates until it becomes overwhelming and even unbearable. We hear about this balance thing, but are never actually taught how to achieve it. Then add in social media and seeing others who look like they have it all, the perfect job, practice, family, physique, social life. And it can be the perfect mix that creates a downward spiral for all too many people. And that's why I wanted to have today's guest, Dr. Brett Gilbert, on the show. Dr. Gilbert graduated from the University of Maryland Dental School in 2001 and stayed in Maryland to complete his residency in endodontics in 2003. He maintains a private practice limited to endodontics in Niles, Illinois, and is a partner in US Endo Partners, where he serves on the clinical advisory board. He's a professor in the Department of Endodontics at the University of Illinois, Chicago, and a diplomat of the American Board of Endodontics. Dr. Gilbert founded Access Endo, a global education platform, and co-founded the Dental Yogi Academy. He was named a top 10 young dental educator in America by the Seattle Study Club in 2017. And in 2020, he won the People's Choice Award as the top instructor for endodontics by Course Karma. Dr. Gilbert is also a fellow in the International College of Dentists and a contributing consultant for the Oral Health Journal. He lectures nationally and internationally on clinical endodontics and wellness. So with that, I would like to welcome Dr. Brett Gilbert to the show. Welcome, Brett.
Thanks, Mike. Great to be here. Excited to be a part of your podcast and have a great conversation with you today.
Thank you. Really excited for this. As I mentioned in the intro, I really try to incorporate a lot of different topics into my content. And sometimes it goes in themes. We'll have a few episodes in a row of one. And I really don't even plan that out super strategically. I just try to always bring my audience something that can help them in some way, personally or professionally. And when we spoke, and I was connected to you through a friend and someone I've come to know through this platform, and we instantly hit it off when we first chatted prior to this, and had a real similar story, similar journey. We're similar ages. We have similar families. It's just a very interesting trajectory that we've both been on. And I want to explore that more in your journey and really see what we can do together to talk today to help our colleagues out in some of the areas I mentioned. So if you could just start by telling me a little bit about your personal background, your professional journey, and what's brought you to this point in life.
Yeah, thanks, Mike. And yeah, there were, as Mike and I began to speak, we realized, how connected we are in life, and I think in philosophy, and we also both have two daughters, so that's always a great bonding point. But so son of a general dentist, always hung out at my dad's office.
Son of a general dentist is another similarity between us. Yep.
I actually recently had something happen, when a message came through to me, a text message, and it was something about DDS, the degree DDS. And it brought me back in that moment to being a kid and seeing my dad sign his name with DDS at the end. And I remember, going to my dad's office and seeing on the door DDS
Mm.
and saying to my dad, Dad, what's DDS? He's like, well, I'm a doctor of dental surgery. And I remember thinking to myself, wow, my dad's a doctor of dental surgery. Like that was impressive to me. That
Mm-hmm.
sounded important.
Mm-hmm.
And it made me feel really proud of my dad. And I
Mm.
think, it's just funny how a certain moment comes where you have this very deeply rooted memory. And I think that was when it all began, when I felt that I wanted to be like my dad. I wanted to be a dentist.
Mm.
And so grew up in a dental office, understood the dynamics. My dad, was master of his own domain. He was his own boss. He was around whenever he wanted to be. He seemed to enjoy his life. And so I grew up always wanting to be a dentist. And so through that lens is my life, the things that I've done, as far as being a student and trying to get involved, obviously playing the game we all play to achieve in high school, to get into college, and then
Mm-hmm.
achieve in college to get into dental school, and achieve in dental school to get into residency, and,
Mm-hmm.
something that we can both appreciate. And then ultimately you get out and the ladder isn't really there to continue to climb. And now you've got to figure out how to like make this life worth living.
Yeah.
And so to answer your question, studied really hard, enjoyed my studies, especially once I got into endo. I really got out with a head of steam. I was motivated. I was feeling excited about my career. And then the realities of the career came. And very, very quickly, I found myself with those same feelings that you described,
Mm.
out of balance,
Mm.
lack some confidence, had some self-doubt in the beginning, as many young clinicians will, put a lot of pressure on myself, much of it unnecessarily.
Mm.
The perfectionism kicked in, not being able to, I always used to say, I know what I want to do here, but these just can't quite do it yet.
Mm-hmm.
And recognizing that that's actually a normal part of the journey. It wasn't that something was wrong with me or, but I was judging myself and beating myself up. And
Mm-hmm.
so in the course of this, first year or so in practice, I really started to look at how could I help myself, because I didn't have a mentor there to help me at that moment, at least no
Mm-hmm.
one who was stepping forward to take a young doctor under their wings. And, it's less about the X's and O's of dentistry. It's more about what's in between your ears.
Yeah.
How do you handle your emotions? How do you deal with the stress?
Yeah.
How do you unwind when the day is done? Those are things that no one is teaching.
Yeah.
And that's why I'm so grateful now to be here with you today. As you mentioned, how did we arrive at this moment? Because I think that I've taken a somewhat unconventional path to really investing as much energy and attention into educating myself on emotional intelligence, wellness, and that's a buzzword right now, but
Mm-hmm.
truly being in a state of wellness, which is a state of ease,
Mm-hmm.
versus being in a state of dis-ease,
Mm.
which is off balance, out of rhythm, struggling, grinding. And so now I've, gotten to a point, fortunately, where, through a lot of practice and, those 10,000 could be 20,000 hours by now, if anyone's read the book, by Malcolm
Mm-hmm.
Gladwell,
Yep.
Outliers. But,
Yep.
clinically, I'm at the top of my game right now.
Mm.
I'm so grateful. I'm able to perform the treatments at the highest level. But with that, it comes an emotional toll. We're on an emotional roller coaster as dentists all day long. And even though the outcome, I can predict that for the most part, my outcome, the end product of my treatment is going to be great. But as you know, Mike, the ups and downs, the roller coaster emotionally to get there each and every hour,
Yeah.
working through a case, that's a cortisol overload repetitively,
Yeah.
chronically, over and over again. So the bottom line is I truly believe that to be the best clinician, the best parent, the best friend, the best everything, you have to really be investing in yourself as a human first.
Yeah.
Sure, we wear scrubs and a white coat. Sure, we are the doctor with the responsibilities and the ability to heal people. But if we're not a whole person, if we're not investing and filling our own cup first, we have
Mm-hmm.
so much less to give. And so that's why we're here, Mike. I'm grateful for you being such a proud and strong voice for this. Your story, I'm sure, is well documented through your show, but to choose yourself as a human first. From that place, you have retaken your power, you have retaken your strength and your energy, and you can accomplish what you truly set out to accomplish in this life, which for me was to feel fulfilled. And so I'm excited to mix it up with you a bit here, talk about the journey. But I wanted to state that if you're out there and you're feeling burnt out, you're feeling tired, if this work and this commitment and the burdens of it are getting you down, just know you're just like everyone else. Some people hide it better than others, but we're all feeling it. I'm more than happy to discuss my struggles, both past and current, and ultimately how I work through it. And much of it is similar to Mike's journey, where he recognized that his health and his ability to be a part of his family in a way that would be something that would last a lifetime, as far as the impression he has on his girls and the way he can support and cultivate his marriage. That ultimately was more important than anything. And unfortunately, I think we do get caught up in the career being the most important thing. And my learning and what I've gained, and even just learning from Mike's story, is it's not.
Yeah.
And life is short. And if we don't make it what we want it to be, it will be gone and the opportunity will be missed. So long-winded answer to kick it off, Mike, but just felt like that was the way it wanted to come out here today.
Thank you for that, for the kind words. First of all, I really appreciate that. It's very gracious of you. And I think people who are listening already are they're going to keep listening to this because you said a lot of profound things just in that short time, and it shows just how stable you are in this arena and how much you've grown, even though you're still working on it, as we all are. To take someone who you were saying early on was so insecure and unsure of yourself to someone who can give that type of response and answer, as not just someone who experienced it, but now as someone who's trying to lead other people on a similar journey, is just so profound and so awesome. And I give you a ton of credit for it as well, because it's not easy. And one thing I want to dive down a little more into is maybe why it's not so easy, because it's true. We all, I mean, a lot of us, I think, acknowledge, like, yes, something's different. Something's hard. And you referenced your dad. My dad was a general dentist. His brother practiced with his brothers in a practice his dad, who was an oral surgeon, started in a family practice that also motivated me for my interest in dentistry and to go into this profession. That generation, it was different in that they looked at practicing like they were going to practice until they kind of physically couldn't anymore, almost. They didn't think about it in terms of how can I get financially stable enough to be able to retire if I want to retire, which I feel is what, starting with our generation, you and I, full disclosure, we're both similar age, pushing 50. So it's a little different shift happened there in that generation. And I have some theories as to why, but I'd love to hear your thoughts on why it went from this, I'm just going to ride it out, I'm going to practice for 40 years, which was certainly commonplace. I mean, I know people in their 70s and 80s practicing today. Yet when I talk to residents and young docs and I coach and teach, one of the first questions they ask me is, how did you retire by the time you're in your mid 40s? I want to learn how to do that. And it's such a fundamental shift with us kind of in the middle, and from the generation that preceded us to the one that's succeeding us. I would love to hear your thoughts on what has happened to create that change. And I don't think it's unique to necessarily just dentistry, medicine. I think it's happening generationally across a lot of professions.
Well, I think first and foremost, I think there's a lot more opportunities now, that are away from the chair. I think we realize the
Mm.
chair is, for better or worse, it is a bit of a ball and chain.
Mm-hmm.
In order to create income as a dentist or any clinician, essentially you have to be sitting at the chair treating patients. And
Yeah.
there's an impact of that. There's a psychological, mental, emotional impact. There's absolutely a physical impact.
Mm.
And it's trading time for money. And in the past, I think that was what the expectation was. But now in this day and age, there are other opportunities. We can see there's different modalities to teaching. There's different medium, like this virtual medium. What
Mm-hmm.
we're looking at each other in the face here, but we're in totally different states and we're creating content together.
Mm-hmm.
So I think that ultimately there's people that, as a youngster, and I'm going to say for the most part, as a youngster, you choose this profession.
Mhm.
You enter school, you're just 20, 21, maybe 22 years old, and you invest an awful lot into it, more
Mhm.
now than ever in terms of finances.
Yeah.
And then once you're done, it's like, well, now I'm like, this is what I do.
Yeah.
And for those that it resonates and it's a calling, and, aside from being good at it, because I think, you and I have discussed a bit of, both of us really at the top of our specialty game,
Mhm.
but yet, there's something there that is out of alignment,
Mhm.
maybe with who we've grown to be.
Mhm.
But for others, there's not. It fits perfectly. And for those people, they're blessed.
Yeah.
Let's be honest. They're
Yeah.
blessed.
Yeah.
They love what they do. They'll do it till they're 70.
Yep.
That's what they want to do. And then there's others that realize, wow, well, the person that applied to dental school is like so many generations different than the person sitting in front of the mirror today.
Yeah.
And what's true for me now? What would
Mhm.
make me the happiest now? Because there's a cost and a benefit to everything. And when you're not happy in your career or you're struggling, it impacts who you are. It impacts how you make people feel. It impacts your family.
Yeah.
And so what I found was similar to you, Mike, is I recognized that the way I was living had to change. It wasn't working. And
Yeah.
I was grinding and I was doing everything my dad had done. And so as time changes, I think generationally we start to change. So now we see doctors who are starting to look at what else is possible for them.
Yeah.
And once you catch that bug, the problem is that the clinical dentistry can almost become an even greater burden.
Yeah.
And so what I hope to accomplish, and my intention for this episode, is to say, yes, sometimes doubling down and getting more invested in the profession will help you. Other times, diversifying, maybe finding other things that also counterbalance the dentistry will help you. In some cases, stepping out altogether will help you.
Mhm.
And then the most important thing is to recognize the fourth option, which is reframing how you view your career
Mhm.
and your role and how you do it, and mixing it up. It's just an opportunity to shake it all up and say, maybe I can just find a way to be my authentic self, who I am today, but be that person in the operatory and stop trying to play a role, speak, talk, act like a mentor or emulate someone else that we think does it better than us. Let's just show up and be our very best self. And the way that you do that, and to allude to your question, which is why it's so hard, is to be your best and truest self. I believe you have to dig deeply inside and find that trauma, find the pain that has so defined who you are.
Mhm.
Because we all have trauma, we all have pain. Sometimes it leads to a lot of self-limiting beliefs and
Mhm.
self-doubts. And the only way you can get rid of all that is to actually do the very painful work of going inside, touching and feeling that which has hurt you in the past, and eliminating it. Because our trauma sits inside of us like a stone. And as life is coming at us, it should easily be able to pass through us. But
Mhm.
when life has to divert around that stone of trauma in your chest that you've carried with you, like it's an obligation, you realize that everything in your life is being impacted by that trauma. So a thought, someone says something to you, and it's like moving a little bit and having a shard of glass that cuts you all over again. So I found that I was carrying so much pain and trauma from my early life that until I actually got rid of it, I didn't even know it was there.
Mhm.
But to answer your question, Mike, what I believe the hard part is, and the hard work is to dig into your trauma, touch it, feel it, scratch at it. Because once you bring it to light, and once you address it, poof, it just sort of vaporizes. And now life can come at you. And instead of having that stone in your chest, you've created space for joy, for creativity, for fun, for living. Because unfortunately, I think we wind up being in a position where we're just doing.
Yes.
We're not living. And I
Yes.
choose life.
Yeah. Yeah. And I agree. I agree, as somebody who went through this shift, as you alluded to, and was doing the grind for almost 20 years in my own practice, busy, thriving practice, and wanting to go out and teach more, and feeling that pressure that I knew this was my calling to go do this in the second half of my career, and not being able to find the right associate to come in to transition my practice, and those pressures they start to pull you away from who you are, and they start to expose a lot of those past traumas and past issues and your weaknesses, right? The areas where you're not as strong. It's so well said. When we're at that chair and we're doing what we're doing, most of us again, and those of us who are blessed, you get in that zone. That's not where it's really coming from necessarily. Even the challenging patients and those stresses, there are stresses, but we're pretty resilient. And we've gone through a lot. We've gone through a lot of training. I don't think, in talking to a lot of colleagues, that it's necessarily the day in and day out challenges of patient care that really push people over this limit. Again, not saying that's fact. I'm just saying, in my opinion, in talking to people, I feel a lot of us almost thrive on that. We almost take our patients' problems and challenges kind of too personally, and that can
True.
be a bit of a burden that we carry with us. But we go into this to be providers, to be caregivers, to make a difference in our patients' lives and in our communities, right? What you saw in your dad, what I saw in my family's practice, those are things that speak to us by and large as professionals and caregivers. The challenge is all the other things that you mentioned that happen around that, and trying to manage and balance that. And the busyness almost becomes a bit of a burden and a curse. So the very thing that we find the most fulfilling, the very reason we went into this, ends up being, and again, not each individual patient, but the weight of all of the busyness that's created from it. So I just, to parse that out, it's not that the individual patient here or there is what's making or breaking somebody. It's the weight of all of that volume, of all of those stresses. And then you compound that with financial stresses and the social pressures and all of the emotional stress that goes into this, the social media pressures, as I alluded to. And there's a couple things that you touched on that I want to just go into a little bit more. I'll give you the two, lay them out, and then we'll kind of talk about it. One would be kind of a vision that you alluded to, or lack thereof. And the other would be the trauma. So from the vision perspective, I agree. I say all the time when I teach, we are kind of rats on a wheel of this get to the next level, right? In our schooling, it's pass the next test, do well on the next exam, get into the next level of schooling, repeat, right? Rinse and repeat. I mean, it's like, that is what we're doing. It's how we're trained. It's how we're wired. And I've been teaching residents since I came out of my residency. I was actively involved in teaching residents from the time I started in my practice. And I've seen a lot of residents over the years and seen one common theme. And that is, they get to the point of being done. And this, even if it didn't go into residency, just finishing dental school, because I trained general practitioners as well in a GPR, get to the point that you finish dental school and you go out, maybe doing a 1-year program or oral surgery 6-year program, whatever it is. When that meets its end, no one taught us how to plan for what's next. And not even taught us as in like the business side of it, right? We know that we don't get taught that side, or the insurance side, or whatever it is. Taught us on the vision side. What do you want Dr. Gilbert or Dr. DeLuke? So what does that look? Who does he look like in 5 years, 10 years, 20 years? Nobody talks to us about that. And I think a lot of the reason a lot of us get somewhat lost in this is, I can speak to myself. My vision was to build a phenomenal practice that set me apart in my community as the orthodontic practice to go to. I was very clear in that. And I knew I could see myself at each stage. And Brett, I accomplished each stage. Where I failed was I didn't have a vision for if I couldn't find someone to pass that along to. And I even saw my vision as a teacher and educator beyond that. But I didn't know how to plan for what if if all those things didn't come to be. No real contingency plan there. So even some of those of us who have a vision, we don't necessarily know how to revisit it. So before we get into the trauma side, on the vision side, what are your thoughts on that? What have you seen, and what advice could you give to help people create that vision of themselves other than just now having those letters after their name?
Yeah. I think most importantly, it's, redefining the definition of who you are, because I think, to your point, as we're going through that, quote unquote rat race of school and achievement, we do sometimes push down our authentic personality and identity because it doesn't necessarily fit. You're going through a system. And so you sort of mold yourself to be someone who can thrive in the system.
Yeah.
And in some ways, to your point, you lose who you truly are.
Yes.
And so I think finding, what lights you up. To me, life is easy when you go on the basis of what brings me joy. what, when I think about doing, lights me up. And on the flip side, what, when I think about doing, makes me feel constricted and stressed.
So
And
you're saying do that
unfortunately,
even early on.
yeah,
You're saying early on when you're just running on that wheel spinning, stop, take some time to think about what are your extremes. So I said, like, what brings me joy and fulfillment at my core, and what
yeah.
brings me just stress and anxiety at my core.
Yeah. And being open to exploring, because what I think we fall into the trap of that time of our life, also socially, you're in your 20s, you're young,
Yep.
you've had a stressed out week. So you go out and you party and you blow off steam,
Yep.
and, so that also isn't really who you are.
Right.
So really nowhere are you finding that alignment with who you are. So to me, it's about exploring practices, whether it's journaling, whether it's going to a yoga class, whether it's finding some outdoor space where you can spend time, but being able to ground yourself back and remembering who you are, because that seems so simple, Mike, but to your point, no one's mentoring us in that. And
No.
so we often find that because we so desperately want to be successful, we just follow the blueprint of someone else.
Yes.
And my suggestion is to continue through every stage to find ballast points in your life that remind you who you are, what you love to do, and then investing time in exploring that, so that, to what I was saying earlier, so when you walk into the operatory, right, when you have invested and given back to yourself, when you have fueled yourself with those things that bring you joy and fulfillment, there is no doubt in my mind that the patient in that chair gets better treatment.
I agree.
And when you carry the weight of the world and the stress and the burdens and the disappointments and the frustrations, and you carry that into the operatory, there's no way you can perform at your best. So if you want to be a great clinician, if you want to have a great career, great. Focus on you first at your core. And that leads in. So that's the vision, right? Is reminding yourself that through, like you did, building a beautiful practice that contributes to the community, and being a great educator, all of that is a huge vision to hold. But to hold it up, we have to remember who we are. And that's the part that gets lost. And that goes back to the trauma.
Yeah.
Because the trauma actually
right.
contributes to us losing ourselves.
Right.
And it's really hard to revisit painful memories. And, we're so good at suppressing and burying. And in some families, that's just the SOP,
Yep.
you just shove it under the rug and you keep moving on.
Yep.
But the reality is that you don't move on. You wind up carrying it like two heavy suitcases all day, every day. And no one ever gave you the indication that you could just literally put those suitcases down and keep walking without them and start to be who you freely want to be. So vision is so important. And, to the point though, like, you did everything right. You nailed it. You literally fulfilled your vision. The successor was not part of that vision as far as the universe was concerned, right?
Well said.
It was part of it in your mind.
Yeah.
But think about it this way, there's no accidents. Nothing happens, by chance. So to me, Mike, when I hear your story, I think that one of the blessings is that there was no successor.
And I can say that I agree with you now.
Right? You did it your way. You untangled yourself, which in and of itself, listening to the story and imagining it on the surface, but actually how you went about untangling, and to your credit, seeing everything through to the end for those patients that were under your care. But you may have been stuck there another 5 years, and even if it wasn't at the full capacity, it would have been your mind, your heart, your focus, your attention, your energy. And without the successor, you actually were able to just literally turn the page, start a new story, and put everything you have into it. So although that part wasn't part of your vision, I think in the journey of your story, the universe had other ideas. And that's, we alluded a little bit to earlier, some of the things that we don't see, there's tangible in the world and there's the intangible, there's the physical and the non-physical. And there's the energetics of all of it working together. And if we pay attention, again, something we're never taught, we pay a little more attention, we start to realize that this is not all just what it seems. There is a much bigger picture, a deeper picture. And if we can tap into it, that's when the magic starts to unfold.
I want to talk about that a little more. I'm glad you brought it up. I think that a lot of people that go into science professions, we're very analytical, right? We're very technical, analytical. We want to see, touch, feel things. We don't believe it until we can experience it. It's part of the reason why we go into this field. It's part of what makes us good in this field, very literal. And when people hear people talk about sort of the metaphysical, the supernatural, the things beyond our control that you were just referencing, which I completely agree with you on. And I do completely feel it was my destiny and calling. And those were the cards, be it God's plan or supernatural, whatever people want to call it, that it was not meant to work. As devastated as I was when that happened, as crushed as I was for all I'd put into bringing that person into my practice and having to let them go in a few weeks and everything that sort of seemed like it was falling apart, I wouldn't be here talking to you right now. I wouldn't be living in Florida. I would, all of these things, because as you said, I would have still been there mentoring and guiding this person transitioning to my practice, thinking the plan, it was till like 2026 ish. And we're sitting here in 2024. So I was going to be doing, as you very accurately alluded to, less than I was, but I still would have been engaged and it would have been pulling me away from the ability to give 110% to what I'm doing now. So I do believe it happened for a reason. And there were things beyond my control and that have happened many times in my life. Things that there is no rational answer for it. There is no study to prove it. It just happened. And I feel like a lot of times people who are wired such as we are, it's very hard for them to see anything outside of the natural, the existence, right? What we can see, touch, feel, smell. What is your advice to those who just feel there's nothing out there else guiding us? And again, I don't mean to turn to a religious conversation about what you believe. That's not even my point. It's just the belief that there's something greater than us. Because I do find that the people with whom I speak who do believe in something greater than us, that there is some power acting on us of the universe, they tend to be able to redirect and shift their course with a little more ease than those who don't. Again, empirically speaking, I don't have anything to prove it. And I know there's some studies that do say that, but in my personal experiences, I've just seen that in people who have this higher faith, this deeper belief in something greater than them. They kind of try to fulfill their calling and their mission in life, even when things get turned upside down. And I feel that those who don't, when those things happen, it's a lot harder for them. What do you think about that?
Yeah, I mean, I think it's, there are people, quote unquote, they call them realists. I have, plenty of people in my life like that, who don't really believe that there's anything beyond what we see.
Yeah.
A powerful image that came to me through, actually from Wayne Dyer. I don't know if you're familiar with Wayne
How do I know
Dyer.
the name? Yeah.
Really amazing spiritual leader and amazing speaker. Wayne Dyer and Ram Dass are my two sort of mentors. I listen to them constantly. You can find them on YouTube. They're all over. But Wayne talked about when someone dies, okay, in the moment that they die, the physical body with which they had lived, it weighs the same as it did when they were alive. It has all the same parts. Everything that was alive and working is still there, but the light's gone out, right? There's no longer that light there. They say that the eyes are the windows to the soul. So that part's gone.
Yeah.
So let's get into what is that window? What is inside there? What is the soul? Because in reality, I believe that we are spiritual beings living a human experience.
I agree.
Right? So these bodies, this is like a suit. It's like a space suit. And, your soul is in here. We all know that when someone's alive and you look at them, they're alive. And if you've ever had an opportunity to witness someone who is no longer alive, there is like no question they are not alive. So although the physical element of the body remains identical, at least for a very short period of time after death, it's not the same. So there is something magical about being alive and about being this spiritual being inside of a physical body. And so with that, you have to at least give some credit to the fact that there's something way bigger. Like we're born, we don't really remember where we came from, and then we die, and we can never tell anyone what happened behind the scenes.
Right. Right.
So,
I like
so,
that. Yeah.
and if you'll notice in life, there are synchronicities that happen. You know, there are things that you think about something and then it sort of shows up. And
Yep.
so I believe that we are connected on a higher level. Now, whether or not that's something that you have evidence of that you can hold and feel, I understand there being some question about that. But what I start to realize and like you said, whether you call it faith, religion, God, or just in general, a great term is universe,
Yeah.
right? The
Yeah.
universe is
Yeah. I like
always
that.
sort of
Yeah.
energetically meeting you where you are.
Yes.
So if you're, thinking positive thoughts and envisioning a great life, most likely that's exactly what you're going to create.
Mm.
And on the flip side, if you're negative and you're doubting and you have bad thoughts, so what we're talking about is, and you used it before, the word manifestation, right? You're manifesting. We are actually have the power to create the life we want. And the only thing that gets in the way of what you want and getting it is you literally believing in it and believing that you're worthy of it. And so we have to learn how to basically think the thoughts openly and freely, and then believe in ourselves that by simply thinking about it and envisioning it, like you talked about the vision, Mike, that's like setting an intentional blueprint for how life's going to go. The universe will help you get there, which means, well, I don't have enough money to write that book. I definitely don't have enough time. I don't this, I don't that. And the reality is, if you believe in it, and you don't have to know how, just believing that it will happen. And then all of a sudden, maybe a little extra money comes your way, right? Maybe all of a sudden you do see that your schedule could be rearranged and you could buy yourself a couple of hours every week.
Mm-hmm.
Maybe it's, re-examining where you're actually spending your time after work. And all of a sudden now you do have the time and the resources to write that book, but will you write it? Right? So it's about putting yourself in a position to have the things that you need to fulfill your vision come to you. So it's about what they call the law of attraction, right? The universe will meet the vibration at which you're at. And so you just have to have one thing that's hard for a lot of people to have in this life, Mike, which is trust. I trust that I am going to be that person that I envision I'm going to be. I'm going to have my podcast. For me, that was a big one in the last few years. I wanted to have my own podcast, but didn't for this reason, for that reason. Now I do.
Mm-hmm.
And I'm very proud I was able to manifest that. Much like you're coaching. I do the same thing on the endo side. I developed an online coaching program. That was a manifestation of me getting out of my own way, the doubts, the fears, and having faith that if I put it out there as a vision, that the universe would help me find the resources to make it happen. And it did.
Yeah.
So all we can say is you can't take our word for it. You just have to try it. You have to hold the vision, get out of your own way. And a lot of ways that you do that, in my opinion, are deal with what's hurt you, heal yourself, forgive yourself and others, and allow all that energy and space that's being taken up with resentment and disillusionment about relationships and self-judgment, and letting that go, because you will create space that you can fill with, like we talked about, things that bring you joy, things that raise your vibration, even the circle that you hang out with.
Yep.
If you're hanging out with the same friends that you've had your whole life that keep you in a space where you don't believe that you can accomplish what you want to, maybe try a new circle. Because if you're around uplifting people, like I meet Mike and I'm like, man, this guy's like, I want this guy to be part of my circle. This guy inspires me. This guy he's not only living his vision, but he went through painful steps to get there. And with what? Nothing but trust that at the end of it, he would be in a position where he would flourish, which you are. So I acknowledge you fully, but as much as that is amazing, that shouldn't be an odd story. That could be all of our stories, and it would never look the same for anyone. But if we simply hold the vision, trust it, and let the fear, the doubt, the pain, and the trauma go, I believe we become unstoppable.
I absolutely couldn't agree with you more. And I would encourage those who don't trust, because a lot of people hear us talk and like, oh, that's great, Mike and Brett. You guys, you've done this, or now we're kind of middle age, as weird as it is to say that. We have a few years behind us now. And I'm sure there's younger docs who just say, that's great for where you are. It's easy to say where you are. And I think even older docs could say, well, yeah, who are later in their careers or lives could look back and say, well, we didn't know that then. We didn't have all this then. So I couldn't be that way. I just encourage people who don't think there's something greater than you or the universe as you describe, which I really like because it's all encompassing, to number one, as you alluded to, open your mind to it. Be able to put things out to the universe and be willing to take those chances and change your mindset. I would also encourage you to stop and for a moment, as much as things could be tough and bad and challenging, stop and think about all those things that happened to you that you can't explain, that you don't know why they happened. That at the time, we're using the example of what happened with the failed associateship that I was trying to implement, is devastating, right? Or something lines up, or you meet someone and they happen to know someone else that there's just no rational reason why. It just happened to me recently with a guest who's been on my show and a guest who's going to be on my show. And it turns out her story is amazing. Coincidentally, it's on this. It's actually, she had a husband who was a dentist and he committed suicide, and she's going to be coming on in a few weeks. And amazing story, amazing human, Melissa Methvin. I'm really excited to get her on and just let her tell her story. It's amazing. Tough stuff, but amazing. And I think really important. And I give her a lot of credit for putting it out there to the universe again. And she has a lot of these same philosophies. But I was having a call with her, and when she said she names this town in Arizona, and it's another guy who's been on my show who just started a practice there, who is just such a positive human, Trevor Nichols, and such a wonderful doctor and human. And they're like within miles of one another. And I'm thinking, think of just stop and think of the odds of that, right? And there are two people who I look up to just in the brief interactions I've had with them as just, like you said, people you meet and you just want them in your circle. They're positive. They're a radiant light, and they're within minutes of one another in the same town in Arizona. And you just think about this, and that's just a small example, but just stop and even, I wanted to give a sort of a mundane example like that of just, geographically where people live, just to tell people it doesn't have to be some grandiose, huge stars align, the significant other of your dreams, like falls from the sky type of thing. It doesn't have to be these monumental things. It can be something that seems pretty mundane, yet there's no rhyme or reason for it. And it's that universal pull, that universe pulling this higher power. And if we have the faith and believe in something greater than us, I feel a lot more doors open for us. And so I just encourage people to take a couple minutes, think about it, you meditate on it, or breathing exercises, or whatever your thing is. I want to talk more about that with you too, some of the strategies for these things. But whatever you do, or just while you're driving, just turn the music off and turn the podcast off and just think about it. If you're listening to this right now, pause it and just think about those times in your life where things happened that just didn't make sense, and you grew out of that, even if not at that time, but something else came out of that. The other thing I would say is it can be very lonely if you feel like this is it. If we are it and there's nothing beyond us, we're all not going to be here one day, right? Fact remains, that's undeniable. At some point, you and I will not be walking this earth. I don't know when that is, but it's going to happen. And not to get overly philosophical, but the point is I would like to hope that while I'm here, I'm doing things to make this world a better place, because I won't always be here. I can't, when I was ending the time of my practice, a lot of my patients were really upset, and I completely understand. And I would say to some of them, at some point we all stop doing this, right? At some point you hope to be good enough that that your patients would be sad that you're walking away. I know it's a different time for different people, but you hope you left it a better place, and then you can use those abilities to go do even greater things and help make the world a better place. And that sounds, we were talking before that things like kind of woo woo, like, but I think it's important to just say that. It's important to just get it out there that this isn't hokey. It's not, oh yeah, it must be nice to believe in these things. Stop and just think about the blessings in your life. And as hard as it can be, as awful as times can be for so many of us, and I get it, what is it that you're thankful for? What is it that happened in your life that has made you a better person? And the last thing I want to say about that before I ask something else on it is actually, before I ask you to kind of expand upon this with your own thoughts, is the people that you're surrounded by. And you said, when I made this transition, when we talked prior to this in the call we had before the podcast, talked about our spouses, the role that, and it can be just someone who is there for you, right? And I know when I was going through those times, my wife Renee offered me a ton of guidance and support to help me see who I wanted to be in the end, knew me and was able to help me through that. And I know you had mentioned the support and love that your spouse has given you in that journey. And so often I find, and this ties into the story that I don't want to give too much away, that Melissa will be telling when she comes on, but too often we put the face on in public. We have to be that doctor, that professional walking around, right? Smiling for our team, for our patients. And we take it out on those who are there to love and support us, and kind of close our minds to the help and support they can give. And I think it's just human nature. I don't pretend to know the reason for that. It's beyond my pay grade from a psychology standpoint, but I would like to hear your thoughts on that and on your journey, finding those people who, and the other thing on that is relationships come and go, and that's okay too. You just be the person, you alluded to it, the person you were going to the bar with and celebrating with after a big test in dental school, you may not have a ton in common with them anymore. And that's okay. I mean, there's seasons of relationships, and a lot of people, I think, mourn the loss of a certain relationship, not a passing of someone, but of the relationship. And they think, well, before used to be like this and this. And I found for me, it's very freeing to realize that there's many seasons of my life. And one season was those schooling years we talked about, right? The grind, the gut it out, to get to the next level. The next season was building and growing an orthodontic practice that I was extremely proud of and was very lucrative and did amazing things for my patients. And now the new season is teaching and coaching to try to spread my knowledge and abilities to others and help others on another level. And it doesn't mean any one of those seasons is better or worse than the other. I find that we're just hesitant. You alluded to this a little bit in the beginning when you were talking about that, not really having guidance on how to steer differently on our course. We don't really know. We're almost not okay with that. It's like, I'm this. I'm an endodontist. I'm an orthodontist. This is what I do. And we don't stop and say, no, that's my professional career. That's not who I am. And even if you want to say it's what you do, okay, it's what you do, but it's not who you are. And I think so many times in our profession, people look at themselves that who they are is that professional. And then when that starts to not go so well, man, that's tough. Because now who you are is not succeeding like you want it to succeed. Would you agree with that?
Yeah, no, totally. A couple things come to mind. I mean, first and foremost, I think what you were alluding to is like a gratitude practice. When you're feeling any kind of emotion, if you feel gratitude, it will supersede everything.
Yeah.
So for instance, everything might be falling down around you, but if you have a healthy child and you can just center in and think about your child and be in gratitude for that, that supersedes the other emotions. So gratitude practice is huge. And with that, I also think what you said was very appropriate about seasons. Justin Bieber, of all people, to quote, as a song says, some people come into your life for a reason. Some people come into your life for a season, but you are a lifetime. And so that, you have these special people. I mean, if you look at how you met your spouse or maybe a significant other or a friend, and you realize that it was so like incredible that the universe conspired to bring you together.
Yes.
My wife and I had two different, completely separate people who didn't know each other try to set us up before we actually met. But the other thing that comes to mind that I think is really important is this, going back to the trauma, and what you were saying is that you have to be able to allow yourself to see that life is happening for you, not to you. Right? So everything that happens isn't happening to you, it's happening for you. And so in the moment, it can be hard to see what the lesson is, what the blessing is from something that happened that everything inside and outside of you says, this was bad for me.
Yeah.
But later on, with more context and perspective,
Yep.
you realize that was the best thing that ever happened to me.
Yeah.
Right. How many times do you hear something like that? And that could be equated to your situation with the associate.
Oh,
Now,
yeah.
I'm really intrigued to hear the story of your guest about her husband, because
Mm.
that's another example. I don't even know this person, but just the small snippet that you've shared, both with your words, but also energetically, right? There's more to it than the words and the look and the feel. Mike portrayed an energetics about this person that I picked up on as you were
Mm.
talking.
Mm.
And so I'm thinking to myself, here, this beautiful person lost her spouse, right?
Mm-hmm.
From a very definable looking backwards reason, right?
Mm-hmm.
We see that the rate of suicide in dentistry is much higher than the general population.
Mm-hmm.
And you could say that happened to her, but what's she doing? She's sharing the story. She's
Mm-hmm.
sharing vulnerably what happened, how it happened, maybe even from her perspective, what she could have done differently. And with that, it becomes this beautiful gift that she shares that saves other people's lives.
Yes.
And so, you wrap all this together and you realize that this life is an absolute journey. It has ups and downs, it has ins and outs, it has amazing highs, amazing lows. But that's what we're here for, right? Again, a spiritual being living a human experience.
Mm.
And that experience can't just be joy and laughter and abundance. Sometimes it has to be the opposite. It has to be suffering. It has to be, disappointment. It has to be all of these things. And to your point, Mike, when you talk about a bigger picture, something, look at your life as this massive experience since we're sentient beings, right?
Mm-hmm.
We can feel. We can feel when we're touched. We can feel touch. We can feel emotions. We can feel things. And maybe that's the gift of being here. It's painful as hell sometimes.
Yeah.
Maybe that's the gift. So lose the victim mentality, just like you're going to lose the holding on to your trauma, and recognize that we're not victims. We're here. We're absorbing. We're part of this world. And if everything that happens is happening for us, we can reframe the meaning of each and everything. And instead of weighing ourselves down and being burdened, we can use them as stepping stones to grow, to learn, to expand, and to become, again, I love this concept of living the life of your own design. When I heard that the first time, they're like fireworks went off inside of me. I thought, live a life of your own design. Well, I can't do that. I'm a dentist. I got to go to work.
Yeah.
But then I look at you and you literally are living the life of your own design. And I've been aware of this for about my personal growth journey started at age 43. I probably should have talked about this a little bit earlier in the episode, but I was on a huge stage at age 43 in front of about 2,000 of my endodontic colleagues.
Wow.
At a key opinion leader meeting. And I made a gross error in my presentation. But if you've spent enough time with me, you'll know that when I speak, I really sell what I speak. So I sold it. And when I got
Did you
off
know
the
at the time? Did you know that it was?
No, I didn't know until I got off the stage.
Okay.
And it was like all the life drained out of me when
Mm.
when I saw people's faces and they were like, oh, Brett, and
Ooh.
that made me realize how tired I was. I had to review what happened. Like, why did I make this error? And I realized I'm so freaking tired. I'm just grinding. I ground through this presentation. I
Yeah.
traveled here. I'm exhausted. And what I am doing is not sustainable.
Yeah.
And what it really came down to was not filling my own cup, constantly giving to everyone else except myself, not giving myself a lot of love, judging myself, coming down on myself,
Yep.
being my hardest critic, and it can bury you into the ground. And at that point in time was the first time I truly felt burnout, but I didn't know what burnout was. All I knew is I felt scared. My body was in pain. I had negative thoughts. I was not happy. I didn't want to continue what I was doing.
Mm-hmm.
And that was a scary moment. So when I got onto Google and I wrote symptoms of burn, and before I spelled out OUT, I said, I'm burnt out.
Yeah.
I'm actually burnt out. This is what burnout is.
Yeah.
And it came on me like a brick wall. But from that, again, back to the everything is happening for you, it forced me to re-examine how I was living. And that's when my personal growth journey started. That's when I went into deep emotional intelligence workshop training. That was when I started to find the pain and heal. And then found back, like we're talking about identity, Mike, like in my emotional intelligence training, which I highly recommend for anyone, but especially for doctors. I went to a center called Next Level Trainings in Columbus, Ohio. What I found was you start to get back in touch with that kid that you were.
Mm,
A great exercise is to close your eyes and envision yourself. I can see myself 8 years old, standing in the mirror with my shirt off, flexing my little twingly, kid arms, thinking to myself, man, one day I'm going to grow up and I'm going to be strong and I'm going to do this and I'm going to do that. Whatever was inside of that kid, that's who you truly are.
yeah.
And when you can go back and touch that again, that's where you start to find the joy and the purpose. Mike said, he really wanted to share his knowledge and wisdom. He wanted to teach and he wanted to coach. And, when I look back at who I was at that age, which I would say I've through a lot of very hard and painful work, I sit here today as that boy, who wants to help people and wants to make people feel better about themselves and
Yeah.
who wants to contribute and, who wants to, like you said, when this life is over, and you said it perfectly, we know we're going to die. That is a non-negotiable. But do we die today? Do we die tomorrow? Do we die in 10 years and 50 years? That part, it's the only expenditure that you have, which is time, of which you never know what your balance is. You could be on 1 cent and never know it, or you could be sitting on $1 million and never know it.
Yep.
So what do you do now? Which is back to that present moment, right? Is bringing us back to who are you?
Yeah.
Who is your identity? What do you love? That's the way to find out. What do you love?
Yeah. That's what I
Maybe,
wanted to ask you actually, is if you can go into a
yeah,
little bit of on that journey, because I know a lot of people are listening thinking, again, and I do say this because I'll listen to podcasts and I'm thinking, yeah, but how, okay, great. You've done it. You guys have succeeded at this. You're at a different spot. For those people who are struggling finding out the why, who are struggling with burnout, as I was as well, who are at that point that they don't even feel like they're going so fast on the treadmill that if you're going slow enough on the treadmill, you can kind of hop off, stand on the sides, catch breath and catch back on. When it's going, there's a speed that it goes, you can't even hop off. And I feel like a lot of people are on that speed, right? The treadmill set at a speed that they're doing everything they can to just keep their feet going one in front of the other. And I feel like that's the point at which you reach burnout, where your only option is to just keep running harder. And because we're wired as dentists and I have other medical professionals that listen to the show as well, but pretty much anyone in those medical professions is probably type A plus by and large. Our tendency is to just run harder. Some other people might be like, well, why don't if you could try this, or you could slow down or take the fall and fall off and then pick yourself up and start again, right? But we just run harder and keep going faster and faster. So what is your advice to some of those people who are running at max capacity and just feel like they don't even have time? Like, I remember thinking when I'd hear about breathing exercises or, cold plunges or sauna, I'm like, I don't have enough. I barely get enough. I'm trying to get 5 hours of sleep a night. I don't have time for one more thing. So what would be your advice to people who are in that situation?
Yeah, well, a couple things come to mind. I mean, the treadmill, and I can appreciate it because I've been on it for years. I'm actually very proud and excited to say that. And I shared this with Mike. I actually made a shift in my schedule that was very helpful. I consolidated my clinical schedule to give me an extra day off, which is today. So here I'm sitting here kind of basking in the gift of honoring what I truly knew in my heart was going to be good for me. But we, as dentists, we unfortunately live in a gilded cage, and the lifestyle that we so desired. And one of the reasons we probably go into this work, oftentimes requires that treadmill, that grind to continue to meet right?
Yeah, it's a good
Meaning
point. Yeah.
you're stuck to the chair to earn your
Yeah.
income. You're trading time for money. You need
Yep.
more money. The lifestyle keeps going up and you
Yep.
have to keep meeting it, which means you're back at the chair for longer, for more. You're
Yep.
trying to expand your offerings so that you can do more. And it becomes just this grueling life.
Yeah.
So I think it's going back to the basics. So you're asking me like, what's a first step? Well, I
Yeah.
want to tell you two books that were pivotal and monumental in those early days after I stepped off that stage and found myself in burnout. And one of them is the book, A Man's Search for Meaning by Viktor Frankl. Now, you may have heard of the book. The distillation, not to ruin it for you, is just this idea that we have to realize that what no one can ever take from us is the love that we feel inside, right? It's love for yourself. It's love for others. No one can touch that. So if you can remember that love is basically the most basic fuel that we burn in our life, and the more love you can promote within your life, the better your life is going to be. And Viktor Frankl, in a very severe example, helps you to remember that. The second book from Brene Brown is The Gifts of Imperfection. And this book really helped me because
I'll put
I
links in
think,
the show notes to these two.
yeah, I think what you're saying, and again, you said A+ personality, perfectionism, this ideal of being a doctor and what that means and the standard for which we conduct ourselves and the amount of responsibility, and all more than ever from our dads and our grandfathers' age is reputation and reputation management and the pressure of online reviews. I mean, dentistry has gotten a lot harder outside of the chair than it ever was before.
Without a doubt.
But what Brene does so beautifully is reminding us how beautiful it is that we are imperfect and how embracing those imperfections is actually the key to embracing self-love and embracing ourselves. So I think to answer the question of how do you touch into the intangible and how do you find what brings you joy and how do you get off of the treadmill, it's to go back to love, and most importantly, the most important love affair you will ever have in your life is within your own skin. So whatever has dogged you, whatever is weighed you down, whatever you think was your fault, whatever you think happened to you, whatever victimness you've assigned to yourself, the greatest thing you can do is to drown that out and flush it out by loving who you are, where you are, finding those things about yourself that you'd like to change and doing it, but doing it in a way that's fueled by love and growth and wanting to be a better version of yourself. Because the only competition you sort of alluded to it with the social media, Mike, we deal with this sort of comparison. They say the comparison is the robber of all joy.
Yeah.
So
and the envy
the
that
case,
it creates, the envy that it leads to, the envy,
the envy and the
huge.
sometimes resentment
and resentment.
Self-hate because why aren't I that successful?
Yeah.
So what I can say to that is the only thing and the only person you should ever compare yourself to is who you were yesterday. And just focus on who you are, embrace your imperfections, love yourself, give to yourself. That means taking a little extra time, maybe waking up 20 minutes earlier and doing some breathing. And I can even give you some links to add into the show notes of the ones I do every single morning. Giving yourself a chance to maybe sit for 10 minutes with some light music, read a chapter, just sit and think about your day. Maybe start to focus a little more on what your intention is in a given day. Because when you set an intention and you write it down in a journal, I find that it's an incredibly subconscious but powerful agenda for the day. And instead of the day, to your point, Mike, being payroll, meet with this employee, 20 patients, paperwork, pay the bills, come home, take out the trash, pick up dinner, be dead tired at the end of the day. Maybe the intention was simply, I'm going to be patient, I'm going to be graceful, and I'm going to be a healer today. And all those other things happened.
Yeah.
But it came through a different lens. And so there's so much to dig into. And, just as a promotion for my own podcast, which is called On the Cusp with Dr. Brett Gilbert, that's actually what my podcast is all about. It's about, I welcome guests and Mike's going to be one. Definitely really excited to welcome him to the show. It's just talking through people's journeys, their ability to deal with obstacles, how they handle joy, what in their career has worked or didn't work. And what you'll find is if you listen to enough journeys, little pieces of it will resonate with you in such a powerful way that they actually motivate you to make changes. And I found that aside from reading books, listening to podcasts, I jumped into the School of Greatness with Lewis Howes was
Yeah,
one of
I
the
love that.
podcasts
I
I
really enjoy
listened
listening
to.
to that. Yeah.
Ed Milet has an amazing
Yep.
podcast. Jay Shetty on
Yep.
Purpose.
Mm-hmm.
So when you talk about changing your circle, maybe you don't change your friends, but you add people into your ride to work or your
Yeah.
ride home.
Yeah.
You start, instead of listening to the news, which
Right.
is going to stimulate your base emotions, your lowest level of energy, you start hanging out with these people like Wayne Dyer,
Yep.
YouTube Wayne Dyer, YouTube Ram Dass, Ramdas, and listen to some of their lectures and just be uplifted and be energized and inspired instead of being pulled down by the negativity and the bias of what is the mainstream media. I think that sometimes you don't realize how much you're letting the outer world dictate your inner world. And when you start to take control of your diet, not just what you eat, what you see, what you hear, right? Then you start to create. I always say, the world is inside of you. And if you allow the outside world to dictate the environment inside, then you're at the mercy of the world. But if you start to take control by feeding yourself positivity and, really being inspired, then you start to live a different life. And my experience, and again, I go back to the emotional intelligence training as a true turning point in my life. And the reason is it allowed me to heal. And once I healed, and that meant healing internally, healing certain relationships that had been damaged over a long period of time, it's like, whoa, like you just like your life becomes so much more spacious and it gives you an opportunity to grow. And I think you said it earlier, Mike, but I think when you have the motivation and the intention to grow every day, the mundane, the burnout, the grind, it starts to take on a different meaning because your intention, just like I mentioned, setting an intention for the day, setting an intention for life to continue to grow really is, from a subconscious standpoint, is such an incredible blueprint to live a different style of life where what seems important, money, physical things, doesn't seem as important as service and contribution. And most importantly, self-love. I believe that self-love is the most important thing that we have to learn. And unfortunately, like for me, my own experience, no one ever taught me that. And in fact, I think I was taught the opposite, right? That, to take care of yourself or to think of yourself first or to feed yourself first was selfish.
Selfish. Yeah.
But in reality, it's the most selfless thing you can do because when your cup is overfloweth, you have so much more to give everyone else.
Yeah. Well, it's the analogy of the airline, right? You got to put your own oxygen mask on before you can help anybody else. And I mean, I remember it's so much so it's funny how these things happen because I remember hearing that even as a kid when we'd fly, and I'm like, well, wouldn't you want to help the kid first? It's our human intuition is, you want to do that you think the parent would want to help the child, but they're saying we have to be reminded so much. So has to be announced to us every time. Like you have to help yourself first, because like you just said, we're not good at that. We're not wired that way. And we're certainly mostly not taught that. And because we're taught that if you do that, you're selfish and it has a bad connotation, right? And you're not helping others. Well, maybe we just need to reframe that and say, and I actually did a Motivational Monday, which early on in my podcast I was doing. Now with the busyness of the show, I haven't been doing them as much, but I can post a link to it where I talked about it's okay to be selfish was actually the name of it. And it was that if you don't take the time to get yourself right, then you aren't going to be any good to others. And that's what I was realizing in my journey is I was getting so burnout and focused on the task that I wasn't who I needed to be. And I was becoming, still at the point where I was kind of hiding it, but I could see the writing on the wall that if I kept going there, I wasn't going to be the orthodontist I should be, or the boss I should be, or the dad I should be, or the husband I should be. I was letting it take me down a path where I was focusing on those negative things. And I really like what you said about this being a mindset more than necessarily modality based, right? Modality driven or task driven, because I know, as we alluded to a little bit before, people hear, Brett, Mike, I can't put one more thing on my plate. Well, then don't put one more thing on your plate. Just change what's on your plate. So don't add, just change it out a little bit, right? So, instead of it being a piece of steak, it's a piece of chicken, right? So you're not eating both. So you don't have to worry about consuming more. Your analogy with what you listen to on the way into work, right? Take off some of that news, sensationalistic, mainstream media stuff that's just getting you fired up, and put on a podcast that's more of a growth mindset, that's got some positive, basically, messages in it to be able to help you get right. And even some that challenge you. You may not even agree with all of that they're saying, but just start to change your mindset. Think about things a little differently. I think if people can really take that message to heart, that's an easy first step. And as Brett was just alluding to, when you start to think differently, you start to act differently. And that's proven. That's not you and I sitting here being theoretical. That is proven. When you think differently, you act differently. And if you can just start there, just think differently, get some of those negative influences. And I would even go so far, Brett, as to say, get some of the negative people a little bit out of your life. And if you have people in your practice or your office who are really draining you and draining your energy, have them move on, right? Look for people that are positive to surround yourself with. You have friendships that, as we said, there's seasons in life. Yes, you may have this friend that's been with you for all these years. It doesn't mean you have to disown or dissociate with them completely, but maybe it's not helping you to be constantly talking to that person all the time if they're constantly making you more negative. Or maybe if social media is making you very envious and resentful, maybe you just tone that down a little bit and don't spend so much time. Put some guidelines on yourself. And if you're on social media for 20 minutes, go on for 10, and then take 10 to do some breathing exercises and some deep thinking and meditation type work. That's really, when people talk about prayer and the power of prayer, Joe Dispenza talks a lot about this in his work too, is you're really just putting it out there to the universe, your thoughts, and you're trying to help create that energy around you to be able to enact change and have positive things happen in your life. So once you get there, so they're on this journey, they kind of have the awakening, maybe some, hopefully we'll have that after hearing you and I speak today. I really do hope that. And they start to just maybe make some changes in their content that they're consuming. They start to have some more positive interactions with their friend circles and colleagues and such. How do you sustain it? Because what happens with us, again, because we're so type A, that just can become the new treadmill. And I know a lot of people who have gone on sort of this health wellness journey, even getting into the biohacking side and all that. And then they become so obsessed with that, that becomes stressful. So do you have any advice on when you start? Because there's no start and stop point to this. It's very arbitrary and somewhat ambiguous. It's like, okay, you're on this journey. Well, am I better now? Am I doing better now? You could ask people around you, but how do you quantify? I mean, some of it is just going to come from you wake up and you feel better, or you don't have this weight or the stress or the pressure, as you were alluding to. But how do you know, or what advice could you give to help people not go over the top with that?
Well, so you said something just a minute ago, you said about thinking differently. And I would take it a step further to say, as a great baseline first step, sustainability step is think gratefully, right? So I'm actually sitting here right now, full disclosure, and I'm thinking to myself, man, I'm really, really grateful that I got to meet you, Mike. Like, we really are speaking the same language. I feel like we're intentionally trying to help others. We're doing it through helping ourselves first. And then from there, just weaving back into this entire episode, I'm thinking, well, how did we meet? Well, I was giving a lecture, and an attendee in the lecture came up to me and said, hey, have you heard of Dr. Mike before? I think you guys would really hit it off. You guys sort of remind me of one another. And so talk about synchronicity, talk about the universe. So here are two guys that have 20 some years in practice, achieved a lot of respect and excellence in their specific specialty. And actually what we're sitting here choosing to talk about is life and being a human that can live the best life by being the best version of themselves. Well, you're going to tell me that the universe didn't have something to do in conspiring to bring us together, to join forces and create this very initial piece of content, but I could envision so much more that the two of us can do
Mhm.
together. And so with all of that washing over me, I feel very grateful.
Yeah.
And with that gratitude disappears all the other emotions. Nothing supersedes every other emotion like gratitude.
Mm.
So think gratefully. You're having a tough day, but think, but when I get home, I'm going to be able to have dinner with my family. Or maybe
Mhm.
the first three patients were really tough and the day is falling apart and you feel stressed and you say, man, it was so nice this morning when I had said to my daughter, have a great day. And she said, you too, Dad. Like
Mhm.
little things. Let's be more open to the blessings and feel them. When you allow yourself to feel them and feel grateful, those thoughts are what sustain this journey of positivity.
Yeah.
Because sure, we could all find something that, is not going well today that you could harp on and drag you down. But we probably could find 10 times more things that are actually so amazing in our life. And we need to double down on that. So, to answer your question, I believe gratitude practice is the number one thing. Being grateful for your own imperfections, being grateful that you're alive, knowing that that could change any minute,
Mhm.
being grateful for the love that you have around you, for that of which you've accomplished, but more importantly, for your ability to impact other people.
Mm.
And anyone that's listening to this, anyone that's coming to us as a clinician, I mean, let's be honest, like you should feel very, very proud of what you have accomplished. And underneath that, you also have to realize that there's a human being that needs a lot of love to continue to impact others. And all of the practices that I do are really designed to center me back to remembering that I'm worthy. This life I'm living is worthy. It's short. And more important than anything I accomplish will be how I make other people feel and the impact that I have on them. And I know that's a number one top of your list, Mike, of why you're doing what you're doing now.
Mhm.
And that's exactly the top of my list as well. So if you start to get into this journey, and yes, you could get obsessed with all these different parts, but if you remember that the purpose is really that your journey is going to help other people. It's
Mhm.
almost like that vision of holding a flame and lighting someone else's light, right?
Yeah.
We all have that pilot light inside of us, but some people's has gotten really, really small. It's barely perceptible. And
Yep.
other people's have a raging fire of desire to live fully. Well, sometimes you just need to shine your light and just give that little spark to someone else. And then they can start to, and then from them comes another. So I think back to faith and trust is trusting that there is a ripple effect of everything that we do.
Yeah.
So if we put it out there beautiful and positive, it's going to ripple and touch someone else to do the same, because this world, like, look at how quickly hate can be transmitted and travel, right? Look at
Oh,
the era of hate we're in. Like, where did this come from?
yeah.
Because people influence one another. Well,
Yep.
guess what? The natural inclination of the human is love. So, in the same way that hate can be caught like a virus, so can love. So,
Mhm.
put love out there, do it inside, do it outside, and trust the ripple effect that it's going to have. And I believe, Mike, to answer your question, that's how you get on the journey, and that's how the journey sustains.
Yeah, that's so well said. And we beat ourselves up so much as you were saying that about if you have something bad happen, right? It sounds so simple if something bad happens to just think, not saying you're simplifying it. I'm saying just in theory and concept. It just sounds so simple, right? If you have something bad happen, well, think about something better. It's so hard to do, especially for us, again, missing tile, dental professionals who we want everything to just be, we work in a world of millimeters and fractions of millimeters, and the precision is so important to what we do. And our brains are trained through our training to always look for that open margin, all right, or that canal that you get to obturate, or for that incisor that's a fraction of a millimeter higher than another. And then our brains are wired. And I think this gets into a lot of where, a lot of times people say dentistry and the higher depression and suicide rates, a lot of it's the isolation and all that. And maybe so, when you're in your own practice, but we're around people a lot. And I think a lot of it is we become kind of tortured souls a lot of times by our own desire to reach perfection, which is why I think the gifts of imperfection, I'm excited to read that, because that's that concept of being so perseverating on that I think of for myself. When you were saying it, I was thinking, like, in a day, right? Let's say I have a team member that resigned, or I had to fire someone in the morning. I mean, anybody who questions what Brett's saying, try to have a good day after that, right? I mean, it's like all day you feel the weight. And back to something you said earlier, we're kidding ourselves if we don't think that every other staff member and every patient we treat that day doesn't know something's different with us. Mm-hmm. And we're kidding ourselves if we think we go home and our kids and our spouse don't know something is different with us, even if we don't say anything about it at all. And I feel that's part of a big reason of why, as dental professionals, we struggle so much with this, because we expect perfection. We are trained in perfection. You bring that crown prep to that, or you have that crown, and that professor comes over and takes that tip of that Explorer, and there's more than a little, and you are belittled for it, right? You're this is terrible. And so we live in fear of that. What if it's not perfect? And I think a lot of us are wired to be perfectionists just to go into this whole thing anyway. I mean, you kind of have to be a little bit on wired that way. So what you're saying is so important to, one of the key words you said that I love is perspective. Keeping it in perspective. And that is a constant struggle for me. Full disclosure. Like, I am, again, I being so type A and so missing tile, it is a constant struggle to keep it in perspective. And when it can feel so heavy when you get that bad grade, to the people that are listening who are in dental school, or you don't get the DAT score or the MCAT score that you wanted, or you don't get into the residency program that you had so hoped to. And those are some of those things we were talking about in the beginning of the show, to kind of come full circle on this, where I know it's devastating and I know it feels awful. Or you lose your job at an associateship, right? Or you have anything, a myriad of things that can happen to you professionally that causes this stress. You have a patient sue you, right? You have a lawsuit that goes on. You have a colleague sue you. There's all sorts of things. We can become so obsessed by those things that it can become almost impossible. And I say almost because it is possible. It's almost impossible to train our brains to not perseverate on them. And I would like to, as we kind of come to winding down here, and that with this, on this note of the strategies, when you are there, because we can change our mindset. We can listen to different content. We can read the books. We can become more aware. When that happens, what helps you when that bad thing happens to, of course, you're going to recognize it and address it, but how do you keep perspective when it's happening to you?
I think it's a sort of a personal ideal to say everything is teaching me a lesson. So when something happens, you say to yourself, where's the lesson in this? What is this trying to teach me? That instantly sets you into such a different mind frame. Whereas instead of lamenting and feeling depressed, you can say to yourself, this hurts really bad. This is not what I expected, but what is this trying to teach me?
Yeah.
What can I learn from this? And that's from, clinical issues. I mean, look, you said it so perfectly. We're trained in perfection. Our eye can see the littlest thing, but the reality is that we are never perfect.
Right.
So it has to be sort of not putting perfection as the goal, but putting excellence as the goal. If everything you do is under the idea of excellence, excellence isn't perfection. Right. So excellence is an opportunity for you to realize there's some wiggle room, because nothing's going to be perfect. And then if something isn't perfect, which it's not all the time, then you can say to yourself, well, what can I learn from this? And so I think that the second something happens, and just to go back to your story, Mike, and just the idea that here after a couple of weeks, this associate who you had sort of, you were putting a lot of weight into this person being able to unburden you, and that fell apart. It's like, what can I learn from this? Like, what is this trying to teach me? Why? And so it goes back to life is happening for us, not to us. And so it's in general. And I love that you're concerned about the person trying to get started and maybe not. But the truth is the way I look at personal growth and the way it was in my experience, I had a buddy of mine who had already gone through emotional intelligence training right when I was hitting that burnout I described. And the way I look at it is he put his hand out and he took my hand and he led me to a sidewalk. And all he said was, it's your choice whether you want to walk down this path. But I think that the answers to the things that are bothering you or the parts of your life that are not in alignment, I believe you'll find them by walking this path. So all we're really trying to do is have you put your foot on the first square of the sidewalk. Then you figure it out on your own. There's lots of people to guide you. There's lots of people, but the key to me in this whole game that we're talking about is just like my buddy Todd took my hand and led me to the first block of the sidewalk. That's really what people need, because then you start to take your steps. And in this personal growth journey, you'll start to gain some momentum. You'll start to feel better. And then you know what happens? Just like Mike said, something goes wrong and you face plant right back into the ground. And you say to yourself, oh no, it's over.
Right. It's not working anymore.
Back where I started.
Yeah.
But what you'll learn is that you actually now from there will bounce back higher to where you were. So there's something that I learned. If you think of the infinity sign, right? In order to soar as high and high as you want to go in this life, you have to be willing to fall just as deeply, going back to pain and to suffering. So you have to be willing to experience the low as much as you're willing and wanting to experience the high. And instead of making it negative to be low, just look at it as part of this well-rounded spiritual being having a human experience. So back to where you started, Mike, the bigger picture is so important because we realize that we're just here sort of moving around this space, but the space is so big and wide, and we often stay in one little area of it that people have taught us to be in.
Yes.
We don't realize that there's so much more to expand into. And ultimately, the good, the bad, the ugly is only what you define it as and you label it as. I like to just think of it as life. It's messy, it's crazy, it's beautiful, it's ugly, it's painful, it's joyful, it's exhilarating. It's life. But you have to see the whole thing and not just focus on that you want to be happy and you want to be good and you want to feel great and you want to have pleasure, because there's more to learn from the pain than there is from the pleasure, but they go together equally. So that's how I do it. You know, it's a big picture thing. And when you do that, you start to realize also how small your problems really are. And you start to have a little bit better perspective.
Yeah. And I absolutely am so thankful to have had you on for that. What you said, a lot of what you're saying, talking, you know, as I watch the show, a lot of times I'm thinking I make like a little trailer to music, and this would be the toughest one I've had to try to narrow down the pearls.
A lot of sound bites.
My goodness. Which is such a credit to you and how well-spoken and profound you are in this. And what I like so much about what you just said is by making it a mindset and not just a modality, all of the modalities, the breathing, the saunas, the cold plunges, the whatever you want to do, the biohacking stuff, I think there's places for all of that, right? A lot of that I do myself. That being said, if you don't get yourself right mentally and don't get the feeling of gratitude and don't get yourself to be confident in who you are and what you are, and as you said, love yourself and what you bring to the table, and then also understand, I love the infinity symbol. That is just this roller coaster we are on, and it's going to be all different points at different times. When you start to gain that perspective and then incorporate faith or something, the idea of this universe or a higher power or supernatural, and you start to realize we're all walking this with a greater purpose through this life, then if you miss your cold plunge that day, it's not the end of the world. Because I think that's what happens to a lot of people. They replace their one obsession or compulsion of something that seems to be negative with something that for a while seems more positive, but then that can become stressful. Because if you didn't do the work to get your mind right and get your soul right, then you're just substituting it with something else that's going to just cause you to, when you do have that bad day, what are you going to do in the office? Go run to the sauna or run to the cold plunge? I mean, I don't mean to be sound flip in that,
No,
but
it's a great
truthfully,
point.
like, what are you going to do if that's your therapy? Or let's say it's meditating. Well, when you, in my practice, when you've got, at that any given point, I could have 8 patients throughout my office in different places. What am I going to do? So, excuse me, as Dr. Mike's got to meditate for 10 minutes. It sounds great. Yeah, but ultimately, those are theories and ways I think that can really help you get yourself to a better balanced state, emotionally, psychologically, neurologically, physically, all of those things, exercise, all of those things. We talked a lot about that in the beginning of the show too, having things that are outside of just your work that bring you joy and happiness and fulfillment, not minimizing them. What I love about what you said is that's not the answer in and of itself. Those are ways to help you. But if you don't get the right mentality, if you don't keep perspective, if you don't get right with who you are, you're going to fall down the same trap again, and maybe even harder that time. And so I love that. I can't tell you how great this has been for me to get to know you. I think, was it Tom Levine? He emailed
Tom
me.
Levine, full
Yeah,
credit.
he emailed me, and
Great guy.
just great. I mean, just to, again, like you said, what are the reached out about you, and how these things aren't coincidental. I mean, there's certainly a connection between us and our passion for this. And I really appreciate your willingness to share. Tell me, just to close up, kind of, what are you looking to do here? What's the next stage for you? What is your goal, whether it be professionally, podcast wise, personally? What is sort of, what do you have? What are you looking forward to here in the coming years?
Yeah, so I'm, really committed to, helping people on their journey, and that's both professional and personal. So, I have my podcast On the Cusp with Dr. Brett Gilbert. I think you'll enjoy it. If you've made it this far, you'll really enjoy the podcast.
Yeah.
I really am reimagining how we teach endodontics and infusing all of what we've discussed with the clinical education. And that's my Access Endo program. And I have this online program. We do live coaching. I mentor you. You can upload cases to me, and I can guide you through your endo cases. So if you're a general dentist who either is doing some endo or would like to incorporate it, I like to look at this holistic approach to exactly what we're talking about now. This exact same guy tells you and teaches you how to do clinical endodontics, but merging the two together, because the mindset and the ability to stay positive and the ability to see the bigger picture in terms of how you're performing dental treatment, I think takes away a lot of the fear and a lot of the apprehension that so many dentists have toward endodontics. So I'm really, in a way, my personal life is this. It's this passion for endo. It's this passion for personal growth, development, mindset, and blending it all together. Because back to the visual, when a healthy doctor, mind, body, and spirit walks into that room, you can literally light up another person's life. You can make their experience great. They can take a piece of that light with them, and carry it into their workspace and their home. We have a tremendous ability and opportunity truly to impact people as dentists.
So
But I think
true.
we miss the mark because
Yeah, we don't talk about that
we're
enough.
not
That's
taking,
such a good point, man.
So
That's such a good point. Yeah.
So that's what I'm passionate about. And that's what I'm doing with my education, with my podcast. I still am a full-time clinician, although now I'm 3 longer days instead of 4 days, which is a gift. But I am trying to find my way through burnout also at the same time, right? I'm subject to all of the same pain points that everyone else is, but I've worked really hard to find the strategies, the mindset, and the right thoughts to allow me to be in a position where I can set an example for others, that we don't have to continue to do it the same way. The word that keeps coming from me recently is a reimagination of how this life as a clinician should and can look, and being an example of that. And then through my own process, being able to help, hopefully inspire, light the flame in others that they can do it too. And from that, I think we can transform this profession, because I think it's really ripe for it. Because most dentists I know are not happy people when you get down. Just like you said, Mike, when you get past the smile, when you get past the everything's great, most dentists are suffering in silence.
Yeah.
And I think it's a problem very worthy to try to bring a solution to.
Well, thank you for uncovering it and being open to talking about it. You've inspired me to incorporate some more of that into what I do. And again, the coincidence or not that having you with this conversation, and then Melissa who's coming on, I didn't plan for these to be coming together in this period of times I kind of alluded to earlier in the show. You can't always plan this. It's people's schedules and trying to coordinate that with myself, but there's a real need, and we don't talk about that enough because it's just not comfortable to talk about. And we are, as we've said so many times, we just put our heads down and we go. And there's a lot of dentists that are suffering, and I'll be talking about that much more in my episode with Melissa. And I feel we can continue to join forces. I'm looking forward to working together with you going forward, and it's just a beginning of a relationship.
I got lots of ideas coming, man. Lots of ideas.
Me too. I'm looking forward
all
to
for it.
Yeah, and I would be honored to be on your show. And how can people reach you? Is there any way? I know we mentioned. I'll put a link to the podcast too, but is there any way they can reach out to you?
Yeah. So, on Instagram, really my handle's the same everywhere. It's at Dr. Brett Gilbert, but a direct message on Instagram is always super easy. You can check out my website at accessendo.org to learn more about my online programs. And, just super grateful to be here. Really have so much respect for, I'm a little bit giddy, that you're a buddy now and we share the same passion. And I'm just, really excited and holding trust, right? That the two of us combined can create even more impact than we could individually. And collaboration to me is something that brings me a lot of joy.
Yeah.
And so I'm just kind of excited thinking about what we can create together, starting with this awesome episode.
Yeah, and I feel the same way. For those on audio only, if you can't see, we both have big smiles on our faces and thinking about what we're going to be able to do together going forward. And I can't thank you enough for what you're doing and for coming on and spending this time to share with my audience. And it won't be the last. I'd love to even have you back at a point in the future just to keep kind of in touch and see some of the things you're doing as you go on your own journey. And I really appreciate your honesty that you're not there saying you've got all the answers, you've got this figured out. You're on a journey still, as am I. And neither Brett nor I are up here saying we've got it all figured out, but we've gone through a lot, and I feel we're trying to help others through what we've gone through, and I admire you and respect you for that. So, Dr. Brett Gilbert, it's been an absolute pleasure. Thanks so much.
Thank you.
Appreciate it. Thank you for tuning into this episode of the Doc Podcast. Be sure to visit theorthocoach.com to get access to ADA CERP recognized CE courses or to schedule a private one-on-one coaching session with me. Also, if you know of someone who would make a great guest for this show, or if you'd like to be a guest yourself, please email me at drmike@theorthocoach.com. And be sure to join the Doc community on Facebook for more great content. Thanks so much for listening, and always remember, you have been blessed with the ability to do amazing things.